The Georgetown Public Hospital Corporation, under the guidance of the recently appointed Minister of Health, Dr. Frank Anthony, is ramping up efforts aimed at tackling the COVID-19 pandemic. Director of Medical and Professional Services at the institution, Dr. Fawcett Jeffrey, outlined the hospital's integral role in the fight against the virus.
Dr. Jeffrey and his team have been directly involved with the management of the COVID-19 patients since the hospital is a Level 3 institution in Guyana.
That the Georgetown Hospital is the end point of medical care in Guyana. So whatever we do or whatever we advise is usually going to be the advice that is taken, because we are the institution that all the other regional institutions and other institutions would tend to emulate. So as the medical director of the hospital, we know that we have a major responsibility to not only the Georgetown population, but to the nation as a whole.
Dr. Jeffrey noted that the Georgetown Public Hospital Corporation has demonstrated major strides in its response to the COVID-19 pandemic.
Our intervention relative to COVID since the pandemic started and since we had our first case was to assist in the training and education of doctors, nurses, and all healthcare workers, not only at the Georgetown Hospital, but in the entire country. So we had trainers go and train persons to become trainers so that at least there would be a uniform response from a medical point of view in the entire country.
Ensuring the safety of staff, patients, and the nation as a whole, Dr. Jeffrey shared how the Georgetown Public Hospital Corporation has mobilized its resources since the beginning of the pandemic.
So we started by setting up checkpoints, which we call screening points, in all the entrances of the institution. And then we had zones that are called triage areas. And these triage areas are where, if you're identified as possibly having symptoms that are suspect of COVID, you could actually be sent to a triage area where you will get a more detailed physical examination and interrogation using a checklist. And if you were deemed possible COVID, then you would actually be sent to get a swab. You would be sent to isolate or quarantine, or based on our findings, that's what we were doing.
The hospital's COVID-19 task force, under the guidance of the new Minister of Health, Honorable Dr. Frank Anthony, continues to respond to the nation's needs in battling the novel coronavirus.
We are happy to say that the policies and protocols that were written at the Georgetown Hospital are actually going to be some of the policies and protocols that will be used nationally to assist with the fight against COVID. So some institutions can take our policies and protocols and modify them according to their needs and use them.
The Georgetown Public Hospital Corporation is also working with the new People's Progressive Party Civic Administration to ensure the smooth transition of patients to the Center for Disease Prevention and Control. Dr. Jeffrey also shared his advice to the public.
COVID exists and COVID is real. And we see what happens to patients who are COVID positive and are severely ill. Our death rate is also going up. And my advice to the public is there are rules, there are advisories that are going out to the public that you should wear a face mask, you should socially distance, you should try to stay at least 6 feet apart where possible. You should only go to places that are safe. Do not, I've noticed persons on the streets at night, at a corner, they're drinking alcohol, they are smoking, they are having a small party, and that is dangerous. Because amongst you, you can have an asymptomatic person, no symptoms, no cough, no fever, but yet while you're in that group, you could be contaminated, you could become infected, and then you could be the unfortunate person who ends up in our COVID ICU and probably do not make it.
For InfoHub, Gavin Lewis.